it is nowadays clear that non-celiac gluten sensitivity does indeed exist, not only in adults, but also in children. There are recent scientific studies showing that this condition can be diagnosed in children as well as in adults. But it seems that the prevalence of this condition in children is lower as compared to adults. This is the first difference between adults and children. And another very important point is that while in adults we know that the symptoms of gluten sensitivity can interest not only the gut and the intestine, but also other systems, for example, headache, foggy mind, chronic fatigue. We know that these are frequent presentation of gluten sensitivity in adults. The first data that we have on children suggests that in children the picture of gluten sensitivity is most focused on gastrointestinal complaints, for example, diarrhea, bloating, sometimes constipation, but symptoms mostly related to the gut. And in this way, the diagnosis of gluten sensitivity in children is sometimes more difficult than in adults, because this clinical identikit does overlap with the picture of irritable bowel syndrome more in children than in adults.